Hello, friends, and welcome to the YouTube channel. I'm Dr. Mohsen Raj. I've done my MBBS from GMC Srinagar. I then did my MD from AIMS New Delhi, and now I'm a DM cardiology student at AIMS New Delhi. And this video is titled Lessons That MBBS Taught Me. So, as I see, many of my subscribers are maybe students preparing for NEET UG or maybe who have recently qualified it or maybe young, maybe first or second year MBBS students. So it is worthwhile to share some of the lessons that I realized that I learned in MBBS and that I'd like to share with you. So they're about three or four in number, so do watch till the end of this video. Number one thing that I must share is that initially we all get frightened by the bulk of the material that we have to read, 19 subjects, maybe 2 3 books per subject, so that makes it you know a lot of material. And in fact, if you go deeper, even a chapter of a book will have a book itself. If you go to your library, any library, any of your college, you'll see that there will be a book on platelets, there will be a book on white blood cells, or there will be a book on muscular disorders. So this information is enormous. And in fact, our storage capacity is obviously limited. But what I realized is that not everything is meant to be memorized. See, even at present, I routinely deal with patients with heart disease. And it's okay if I say maybe I don't remember the dose of a particular drug. It's okay to check it from maybe your mobile phone, maybe from a book. So you don't have to remember everything. It's okay that whatever, the moment you have to examine a patient, or someone comes to seeks a consultation from you, it's okay if you don't know that particular point. You can always go and read about it. So there are only, a limited number of very essential or like those emergency situations that you have to know it, and that you'll come to know, of course, during your MBBS course. But by and large, this huge amount of information, you don't have to keep all of it in your hard disk. But you have to learn rules, you have to learn the concepts, and you have to know where and when to look for a particular piece of information that you need. The second thing that people often ignore is that there are so many departments in your medical college. There are so many esteemed faculty members in your medical college. And how often do you seek help from them? For example, maybe you're facing difficulty in understanding examination of the nervous system, or maybe you're having difficulty in examination of cardiovascular system. How often did you go to a professor of medicine or cardiology requesting him to teach you? Or for that matter, how often did you go to a senior who is a senior resident in your ward, in your college? How often did you go to him that, please teach us this particular thing? So, lesson number two is help comes if you seek help. So, in your medical college, in those 5 years of journey, you will have time points when you are in difficulty. Maybe it's related to your studies, maybe it's related to something else. So there's always that scope. You have so many batch senior to you in the medical college, but there are so many faculty members, some of whom are easily approachable. You should always consult them for whatever problem, academic, non-academic. They will help you. So this, in a way, has a twofold benefit. One, that academic problem gets solved, or that problem gets solved acutely. And second, this avoids that burden or the feeling that you're alone. This is a professional college. Everybody is busy, being busy. He is busy in his own life, and everyone is busy, or running a race. It's not like that. Medical schools, they're not a sprint race. They're a big marathon, and it's a big place. There are so many people in there, so many departments, so many faculty members. Seek help. Now, another point. So when you join medical school, when you join a medical college, probably you initially feel that, a little alienated from your seniors. But trust me, that after a few days of interaction with your seniors, things become a lot easy. So generally, there is no concept of ragging in a medical school, obviously, but you will realize at every step in every prof exam, the person who helps you will be your senior, most commonly your immediate senior. So maybe at the joining of medical school, you'll be looking like this fellow over there in the picture, feeling that the seniors are kind of scolding him. But trust me, as you reach the end of your first professional, as you reach the exam, the first year MBBS exam, you will go to your senior, get your books marked, get the list of most important things that you have to read for the exam. Or maybe you have a problem with your attendance in your class. They know all the ways to solve all the problems in your medical college. Or for that matter, if you have more dreams, you have more desires, of course, there are people in your college, seniors in your college, who will help you out. Maybe some of you sometimes maybe plan for a USMLE preparation. Obviously, there'll be a senior preparing for the same. So you can easily approach a senior, get the material, get the guidance, and you can move ahead. So the lesson is maximum help in your medical life will come from your seniors. At every step, be it in your MBBS life, be it in your post graduation, be it in your senior residency, your seniors help you. So, for example, I joined a DM course. My seniors taught me how to do some of the key interventions that are needed in certain life saving cardiac conditions. Or when you join a residency program in maybe medicine or surgery, you work in ward, you learn from your immediate seniors how to manage patients who are admitted there. So maximum help comes from your seniors, and this is how medical information is learned. See, we don't learn too much from the textbooks. We learn what our seniors teach us, maybe your teachers, your faculty in the medical college, and subsequently when you work as doctors in the wards, your immediate seniors or your other senior fellows who teach you, who take rounds and who teach you how to manage patients. So maximum help comes from your seniors. And one important thing, I see many of the medical students getting, giving comments like, we have limited amount of time. How can we read so much of information? How can we read from so many sources, Harrison, coaching notes, review books? How do you read so much? The point is, or the truth is, that you will never get such an amount of free time as you have right now. If you're in a first year MBBS, second year MBBS, you have the luxury called time. Once you finish your MBBS, once you join a postgraduate course, or even in your internship, once you join other courses, post graduation, super specialty courses, you will hardly get time to touch books. You will have 3 24-hour duties in a week. When you go home, you'll be fully tired after those night duties. You will hardly get chance to read books. If you feel you have less time, I tell you, trust me, you have the luxury of time. You have all the time. Most of you get free by 4 o'clock. You can read as much as you want. So lesson number 4 is you will never have so much of free time. In your MBBS, this is the highest amount of time you will have. And afterwards, you will obviously have less amount of time. And last but not the least, don't think of MBBS and medical college a race which you're running and competing with others. Instead, be like picture number 2 in this frame. You're moving on, you're learning things, but at the same time you're enjoying the journey. What I meant is that don't just run after a goal, don't run it like a race, enjoy it as a walk in nature. So don't miss other things in life. Don't miss your family, gatherings, or don't miss your friends, the gatherings with your friends. You'll make so many new friends in medical school and your medical college. So don't miss that part of life. Hostel life is going to be awesome. Your college life is going to be awesome. Don't make it a race. Make it an enjoyable journey. So enjoy the journey and don't live your life in medical school as a race. So these were some of the key things that I thought I should share with you, with all the young medical students out there. If you like the content, do comment, do like, and do subscribe the channel. Thank you.